Bismillahirrahmanirrahim. Dear viewers, before starting my presentation on parenteral routes of drug administration, so I'm very thankful to Almighty Allah that I'm able to present my lectures to my viewers. So let's start presentations on parenteral route of drug administrations. What is parenteral route of drug administration? So if you remember, yesterday we have talked about the different type of routes of drug administration through different routes. But today the topic which I am going to present, that is parenteral route of drug administrations. So parenteral route of drug administrations can be classified into different categories. The first one is intravenous route. Intravenous route of drug administrations is that route of drug administrations in which we can place a drug directly into the bloodstream, or the administration of drug directly into the bloodstream. That is also called intravascular route of drug administrations. Let's suppose you are going to inject a syringe directly into vein, and then that drug can directly goes through bloodstream to its target site. After that, the second one is intramuscular. That is also called, it can be represented by symbol IN. So intramuscular route of drug administration is actually when the drug is injected into the skeletal muscles. In simple words, intramuscular route of drug administrations is that route of drug administrations in which any drugs can be, the drug can be injected directly into the muscles. One thing should be kept in mind, that all those drugs which can be administered intravenously, so it can be administered intramuscularly. But those drugs which can be injected intramuscularly, so it cannot be injected intravascular directly into the veins. There may be chances of certain complications, so this is very important point to be noted here. The third one is subcutaneous. So subcutaneous, this is another route of parenteral route of drug administration, and with the absorption of drugs from the subcutaneous tissue staples. The drugs can be administered through means subcutaneously. You can say the classical example is insulin. Insulin can be injected subcutaneously. The fourth one is inhalation. So inhalation, this is the type of drug administration, and within a drug can be administered through inhalatory routes, and the absorption of that drug is occurred through lungs. Okay, now let's see here. There are different routes of drug administration. The first one is orals, which is also called intrals, which I have already discussed in my previous lectures. Second one is parenterals, and the third one is topical. Parenteral route of drug administration is further categorized into four. The first one is injections, inhalation, transdermal, and transmucosals. Injections they are further classified into different categories. So the first one is intradermal, subcutaneous, intramuscular, intravenous, intraperitoneal, intraarterial, intrathecal, intratecular, intramedullary. So these are the different forms through which you can inject a drug in the form of injections. The third one is transdermal. So transdermal mean whenever the drug is administered across the skin, so it is further classified into 4 categories, that is adhesive unit, inoctions, enteroporesis, and jet injections. The fourth one is transmucosals, which include this lingual, nasal, and rectal route of drug administration. So I will discuss all these things in detail. Okay, now let's see here. I have already shown in the diagram that let's suppose whenever you are going to inject a drug mean parental dosage form, so it need a very technical persons. You can't perform this activity by ordinary person, so it needs some technical skills. So you will have to inject with precautions. Now let's see here in this first case, you can see here this is intramuscular. So intramuscular route of administration, so whenever the drug is directly administered in the muscles, so intramuscular injection, so this is the angle which you want to inject a drug through intramuscular route. So there drugs which can be administered or which can be injected through intramuscular route, so the angle must be adopted 90 degrees. So the angle for the intramuscular injection, that is 90 degrees. You can see here, this is 90 degrees, so you can inject in this position. So this is you can see this is a technical person who is able to perform certain activities, and that person can administer the drug by intramuscular route. So you can see here, this is 90 degrees. The second one is subcutaneous. So for subcutaneous injections, the angle which is required for subcutaneous, so that is 45 degrees. So you can inject a drug through by subcutaneous route. So you will have to adopt an angle 45 degrees. So it means that all the parental preparation injections of subcutaneous route, the angle for subcutaneous route is 45 degrees. So this is clear. Okay, now come toward the intravenous, the administration of drug directly into the vein. So for that there is also a very skillful personnel required. So the degree for intravenous route of drug administration is 25 degrees. So you can inject it at the angle of 25 degrees, especially in case of intravenous. So you will have to take much care about this. The fourth one is intradermal. So they are different type of route of drug administration. So the drug can be injected through intradermal route, so it needs 10 to 15 degree angle. So let's see here, this is intravenous angles, subcutaneous, intramuscular. So look at here now, and intradermal, these are the angle of injection, so you must will have to adopt it. These are the angle of injections. So for intra, once again I'm going to repeat that for intramuscular 90 degree, you can inject the syringe by 90 degree, while in subcutaneous this is 45 degree, while in intravenous this is 25 degree, while in intradermal, so intradermal that is 10 to 15 degree. Okay, this is epidermis, dermis, subcutaneous. As we know that there are 3 different skin layers. One is epidermis, hypodermis, or you can say subcutaneous, and then hypodermis. So there are 3 main layers of the skin, integumentary systems. Okay, now come to our intravascular administration of drug. Intravascular administration means the process through which we can administer a drug in the form of injections. The absorption phase is just bypassed, and there is 100% bioavailability. 100% bioavailability means that the drug is injected directly into the vein, so it can reach to its channel systemic circulation with no time delay. So in this route of drug administrations, this is precise, accurate, and almost immediate onset of actions. The second one is large quantities can be given fairly pain-free. But it needs some expertise. Without any expertise, you can't inject it. There may be chances of greater risk of adverse effects like high concentration attained rapidly, and there is risk of embolism. So sometimes swelling occurs at the area of injection, or there may be chances of thromboembolism or thrombophlebitis, inflammation in the vein and arteries. Let's suppose if it is injected by the non-technical persons. And there are some other factors which are also required for this. Okay, now let's see here intramuscular. So intramuscular means the administration of drug directly into the muscles. So it is very rapid absorptions of the drug in aqueous solutions. The second one is there may be respiratory and slow release preparations. If we compare the intravenous route with intramuscular, so pain at the site of injections is highest compared to the intravenous route. But whenever you are going to inject a drug in the muscle, so at that time you will have to release a drug periodically, slow release. So definitely the chances of pain at the sites of injections, they may be reduced. Okay, now let's come towards subcutaneous. Subcutaneous, this is another route of drug administration. This is another route of drug administration, and with the drug can be injected beneath the skin. This exercise is these injections can be necessary and constant absorptions. The second one is the absorption is limited by blood flow, which is affected if circulatory problem exists. The third one is concurrent administration of vasoconstrictor while slow absorptions. It means if we can compare the absorption rate of intradermals, or you can say intramuscular, so its absorption is slow. Another route of drug administration is inhalation. So inhalation, this is another route of drug administrations, and with the drugs can be injected in the form of gases and volatile agents and aerosols. Second one is there is rapid onset of action due to rapid access to circulations. So the first one is large surface area is required in thin membrane separates alveoli from circulation. There is high blood flow. So especially the particles are larger than 20 micron, and the particles infect in the mouth and throats. So smaller than 0.5 microns, and they aren't retained. Another thing is, especially in respiratory system, except for high risk hypoxia. Intranasal or snorting snuffs. Cocaine may be partly oral via post-nasal dripping and fairly fast to brain. Local damage to septums and some of the volatile gases also appear to cross the nasal membrane, especially in smoke, solids and air suspension vapor absorbed across the long alveoli like nicotine, opium and THC, previous in crack, cocaine, crystal meth. Particles are vapor dissolved in lungs, fluids and diffuse, and longer is the action than volatile gases. Tissue damage from the particle tars and carbon monoxides. Volatile gases also, as we know that there are some anesthetic agents like nitrous oxides and other precise control like petroleum, distillation, diffusion and exhalation of alcohol. So there are certain anesthetic agents which are used and vaporized form, which are the volatile gases like nitrous oxide and ethers. Lungs-based transfer make a drug to brains in little as 5 seconds. Topical is another route of drug administration. This route of drug administration, the drug is directly applied to the mucous membrane. For example, eye drops, antiseptic, sunscreen, and callus removals and nasals. As we know that in our whole body system there are different cavities, so in these cavities these drugs can be applied there. For example, scans. So scans, the first one is dermal. So dermal is rubbing in a oil or ointment that is cause local actions, and transdermal mean absorption of drug through skin, which is occurring systemic action. There is stable blood levels, no post effect, and topical administration. Let's suppose if we are going to administer a drug topically, so it is no post hepatic metabolism, because most of the drugs must be metabolized in the liver before it's reaching to its systemic circulation. The drug must be potent or patch becomes too large. Okay, now let's see here routes for administration and time until effect. For intravenous route of drug administration, the onset of action is 30 to 60 seconds. Intraosseous administration of drug into the bone marrow, that will take almost 30 to 60 seconds. This is the onset of action. Endotracheal technique requires 2 to 3 minutes. For inhalations, onset of action of inhalational drugs, that is 2 to 3 minutes. Sublingual is 3 to 5 minutes. Intramuscular is 10 to 20 minutes. Subcutaneous is 15 to 30 minutes. Rectal 5 to 30 minutes. Ingestion 30 to 90 minutes. And transdermal or topical variable minutes to hours. Now let's come to our time release preparation. So orals, it can be controlled release, time release and sustained release. Designed to produce slow and uniform absorption for 8 hours or longer. Better compliance, maintain effect overnight and eliminate the extreme peaks and troughs. Time release preparation, the report in reservoir preparation like the parenteral administration except intravenous. So it may be prolonged by using the insoluble salt or suspension and non-aqueous vehicle. Okay, now look at here. This is very important information, that no single method of drug administration is ideal for all drug and all circumstances. Thank you so much, dear viewers, for watching my lectures. So if you have any question regarding my lectures, so you can ask me, so I am always available for your services. Thank you.